Hello, my name is Professor Raman Bedi, and this is a summary of a webinar that took place on Friday, November the 15th, 2019. It's the third of a series, and it's on the importance of integrating general and oral health. Next slide. The webinar series is undertaken by the World Federation of Public Health Associations, Oral Health Group. And I want to say thank you to our sponsors, the University of Geneva, the charity, the Global Child Dental Fund, and Colgate-Palmolive. And we also particularly want to say a thank you to the Taiwan Dental Association, who funded this specific webinar, and we're grateful for that. Next slide. My name is Professor Raman Bedi, and I'm chairman of the Oral Health Group at the WFPHA. I was the Chief Dental Officer for England and currently am chairman of the Global Child Dental Fund. Next slide. For this webinar, it was co-chaired also by Professor Alan Ming-Bung Su. Alan is a Dean of the National University in Taiwan and is also president of the Association for Dental Education, Asian Pacific. Next slide. The first presentation was from Dr. Bruce Donoff. Bruce is the Dean at the Harvard School of Dental Medicine and has been pioneer integration of general and oral health. Bruce gave a background of integration in the United States context, showing how dentistry has become isolated and away from medicine, but there's some real initiatives that is integrating joint teaching with medical and dental students at the undergraduate and at the postgraduate level. He also highlighted the importance of ongoing reports that are calling for integration and how the forthcoming Surgeon General's report, we hope, will include the importance of integration. He also highlighted the important Lancet series on global health, which calls for integration as a solution to the oral health crisis around the world. Next slide. Dr. Suti Chu is well known and a pioneer in Taiwan on health promotion. She spoke passionately about the examples of integration in Taiwan, particularly in relation to oral cancer. Taiwan as yet has not introduced a sugar tax, but they do have what's called a sin tax in relation to tobacco. And that revenue has led to a number of projects which are integration of oral health and general health in relation to oral cancer. Next slide. Mahesh Verma is now the Vice Chancellor of a prominent university in Delhi. Mahesh was unable to attend due to some difficulties, and he yet gave his presentation, and I spoke to it. Mahesh shows that the major health concerns in India relate to coronary heart disease, diabetes, and oral cancer. And in each one of those areas, integration process is being implemented throughout India. He also highlighted the number of patients who attend a dentist every day who have diabetes or coronary heart disease, and therefore integration is essential in providing the appropriate care. Next slide. Dr. Mengistu Asnak is the former president of the WFPHA. He's also currently the country director of the Pathways International Ethiopia. Mengistu gave a unique example of the importance of integration in low-income countries, particularly in Ethiopia. He showed with the lack of workforce, there are no solutions other than having integration and multitasking. He gave the background how different practitioner nurses playing different roles in rural areas and the importance of this. But the most important thing he highlighted is the political actions that's needed to allow for transfer of skills and also the community engagement that is needed. Next slide. Bettina Boesch is the director of the WFH-PHA and is also a professor in global health at the University of Geneva. Bettina brought the whole webinar down to an end, bringing together the varying strands. She showed the importance of political engagement at the highest level, giving examples of global organizations and the importance they have placed on integration. Next slide. This slide was shown to show the workforce challenges that are around the world. Integration is important to everyone, irrespective of location. But even more so, it is very important where there is a lack of trained healthcare professionals. The importance of transferring skills, the importance of multitasking were all there. Next slide. The example in Ethiopia showed how new type of workers can be trained with a range of skills that can be provided. Next slide. So the take-home messages from this webinar are that integration of general health and oral health is not only advisable, it is critical. In low-income countries where health workers are sparse, transferring skills is important. But of course, we need the political support as well as the community engagement. Finally, the take-home message of this webinar is that leadership skills for healthcare workers are needed to ensure that integration happens, and it should be taught at all levels. Next slide. I hope you have an opportunity to see the longer webinar and to see the presentations by our speakers. And finally, I want to say thank you again to our 3 general sponsors, University of Geneva, Global Child Dental Fund, and Colgate-Palmolive, and particular for this webinar, the Taiwan Dental Association, for their support. Thank you very much.